is my video on cast care. So I have Mr. Smith here. He has a fracture of the forearm. As a nurse, we are going to assess the skin that is not in the cast. For educational purposes, this is our cast. We are going to ask our patient if they have any pain. If they have pain, we're going to ask them to rate it on a scale of 1 to 10. And if they do have pain, we're also going to check the MAR to see if they have any pain medications that we can give. We are also going to check the temperature of our affected extremity against our other extremity. Make sure that it's cool and warm to the touch. We're also going to check for paralysis. Mr. Smith, can you wiggle your fingers for me? Awesome. And then we're going to check for paresthesia. So, Mr. Smith, can you feel me touching your fingers?
Yes.
Can you feel me touching above your cast?
Yes.
And then also we are going to check our pulses. With our fracture of the forearm, we can't get to the radial pulse, so we're going to check the brachial pulse against the other extremity to make sure that they're clear and bounding. At the same time, we can also check for any skin breakdown. So we want to make sure that we check to see if there's any blisters or inflammation, redness, any sores that we can see. Once we have done our focused assessment, we're going to educate our patient on care of our cast when we're at home. Mr. Smith, when you need to take a shower or a bath, we're going to try not to get it wet. We're going to make sure that we can either stick it outside the tub or the shower, or if not, you can always cover it with a plastic bag. Make sure that we don't use a rubber band because it can create indentions if it gets wet. We're going to secure that plastic bag with a tape so that way we're able to shower. We're going to make sure that we don't use any lotions or powder on our fingers and above the cast because it can dry and then it can get in your cast and cause irritation. We are going to make sure that we educate our patient not to stick anything in the cast. Mr. Smith, we understand sometimes it gets itchy, irritating. Please don't stick anything in there. What can help with the itching is if you have a blow dryer, you can set it on the cool setting. Also, if it gets wet, you can use a blow dryer as well. You want to make sure that it's on the cool setting, not the high. The high setting can cause irritation and skin breakdown. Also, we're going to educate our patient that if they need to when they get dressed, not the need, when they get dressed, they are going to get dressed with the affected limb first. So you're going to put your arm, your casted arm in first, and then when you get undressed, you're going to take the unaffected arm out first, okay? And the cast arm will be last. Also, we want to make sure that we exercise the joints above and below the cast. So each day, just a few finger wiggles. Maybe we want to do some range of motion exercises on our elbow as well as our shoulder. Then we are going to educate on signs and symptoms of infection. Mr. Smith, if you notice any excessive foul odor, if you notice any blisters, any breakdown above or below your cast, if you see that your fingers have changed colors, we are going to make sure that we call the doctor so that way we can help. And those are signs and symptoms that us as the nurse are going to educate our patient, which can lead to compartment syndrome. Also, if you notice any numbness or tingling of your fingers or your affected arm, to please contact the doctor. And that's my cast care.